Okay, so how about first aid and physical treatments for inflammation? There are definitely some. So the first aid measure that we probably mostly heard of for injury-related inflammation, it's the RICE approach: rest, ice, compression, and elevation. So you're going to rest the injured part. You're going to use ice packs for 15 to 20 minutes several times a day. I usually recommend that my patients don't use ice for more than 20 minutes out of every hour. Let the tissues come back up to temperature for part of the hour. Compress with an elastic wrap to help control swelling, or a compression sock if it's your lower limb. Elevate the ankle above the heart to minimize the swelling. Obviously, this is for an ankle, so elevate the part above the heart to minimize swelling. So cold applications are useful in the early stage of acute inflammation. The application of cold causes local vasoconstriction, thereby decreasing edema and pain. The use of hot or cold applications during long-term therapy and recovery periods depends on the particular situation. And that is something that we will talk a lot about next quarter: hot and cold, and recommendations to patients that we're going to do. In some instances, for example, they give the example in the book of acute rheumatoid arthritis. Heat and moderate activity may improve the circulation in the affected area, and thereby removing excess fluid and pain-causing chemical mediators, and promote healing. So, of course, physical therapy, movement to promote healing is one of our things. That's one of the things that we do. We often want to use elevation to improve fluid flow away from the damaged area. Because tissue damage can change the osmotic pressure, the elevation can help use gravity to help bring the flow back to where we want it. Mild to moderate exercise is useful in many cases of chronic inflammatory conditions, where improved blood flow and fluid flow is beneficial, and mobility can also be improved. So that's a lot of what we do in physical therapy. Other treatment measures include manual therapy, like manual lymph drainage, if it's necessary to maintain limb mobility and joint mobility and reduce pain. Occasionally, splinting can be used to prevent abnormal joint positions and contractures. Rest, adequate nutrition, and hydration are also important for healing. So a lot of the treatments we talked about the drug treatments for inflammation, but a lot of the conservative treatments for inflammation are preferred. So, as I always say, physical therapy is conservative treatment. So I prefer conservative treatment if I can do it.